are your child's greatest medication. Are you burnt out? Are you tired of going from doctor visit to doctor visit? Are you tired of being on this website and that website and trying this food and going to this allergist? Today's the video for you. Are you one of the few? Or perhaps your child is one of the few. Well, this is the channel for you. On this channel, we discuss all things eczema. Caregiver burnout is real. And today we're going to talk about it because most videos are geared to helping your child through eczema. The reality is, if you aren't well, you're not going to be able to help your child through anything. And being able to make the right calls for your child is going to take a lot out of you. So let's talk caregiver burnout. A lot of times people think about caregiver burnout if it's something that seems more serious, like if your child, God forbid, is terminally ill, or taking care of, someone that has a disability. But taking care of a child with eczema is challenging. You're constantly having to be on high alert, things that might cause your child discomfort. I know for myself, being a girly with eczema, every time I walk into a room, I have a whole list of things I'm thinking. Is there dust in this room? Do they have pets? When was the last time this was cleaned? What type of material is this? If I'm about to go to a restaurant, I'm scanning the menu thinking, can I eat this sort of thing? Should I have this today? These are all the things I'm thinking. But those are the things you're thinking for your child. And that mental stress, it plays a toll on a mom in a way that we don't understand. I actually think that that toll is harder on a mom than it is for me, because you know what? For me, I can handle it. I'm fine. If I'm uncomfortable, big whoop. But if my child is uncomfortable, now I have a problem. So I get it. As a mom, you're just like, I just want my kid to feel good. I want my kid to be normal. I want my child not to be in pain. So the one thing that I think every mom needs to have when they're dealing with a child with eczema is mental grit. Okay. You need to be strong. You need to be strong because the temptation to put steroids on your child are going to be there, endless. You're going to want to do it. They're going to cry. They're going to drive you nuts. And you're just going to think, you know what? If I just put this little cream on, it'll all go away. Don't do it. So, mom, you got to be tough. All right. I know it's going to be very hard because we just want our babies to be okay, but you got to be tough for them. You got to make those calls for them now so that later they can live an eczema-free life. Or at least if they're not eczema-free, they have mild eczema, all right? And they don't have to go through topical steroid withdrawal. Another thing that you're going to have to do as a mom, you're going to have self-care, all right? You got to put the oxygen mask on you before you can put the oxygen mask on your child. And I know that sounds so counterintuitive. Whenever I go on a plane and they say that to me, I'm like, yeah, like if anything's going down, it's just instinctual as a mother to do for your child first. But I think that is the best picture of basically what happens when a mom doesn't take care of herself. Because if you are burnt out, you're not going to do a very good job taking care of your child. You're going to be short with them. You're going to make the wrong calls. You're going to be frustrated. And that will add to your child's cortisol levels, because when a mom is at rest and at peace, that subconsciously translates to the child. Your child has very high cortisol. So it is so important that you develop practices of self-care for yourself so that your child can feel at ease. What I want to talk about is called the types of itch, because you know what? All itches are not created equal, okay? When you see your child scratching, there's different types of scratches, or the different types of itchies, okay? So there's the deep itch, all right? This is the type of itch you'll notice if your child is pressing and scratching. You'll notice if your child is also wants to use an object to get to it. That is a deep, deep itch, okay? That type of itch can be very damaging to the skin, but typically they can't help it. When you itch at that level, you can't help it. And I don't think it's wise to tell your child not to scratch, but giving them a safe object that they can use, and also helping them, give them something like an ice pack after the fact to bring down the inflammation. Telling your child to stop scratching is like telling yourself to stop breathing, to stop blinking. It's like a knee jerk. So we want to deal with itch or scratch, whatever you want to say, accordingly. All right. So we've got the deep itch, okay? Then we have the surface scratch. You know that it's a surface scratch because usually it only takes a couple of seconds. It's a 1, 2, and done. Okay, it's harmless. Usually surface scratches are done on if the skin is dry and crusty. If you've seen in my other videos, I talk about the stages of the skin healing. There's the red and inflamed stage, there is the oozy itch that won't quit stage, and then there's the dry and crusty stage. Often surface scratching is at the dry and crusty stage. Usually it just means that the child needs a little bit of moisture, okay? The itch and ooze stage type of scratch, usually you'll know it's itch and ooze stage because, well, first of all, you'll see that the skin is, there's crusties, there's yuckies coming out, that your child might complain that they're wet. Um, you'll see a lot of crusting. You want to be very careful about letting your child scratch the itchy, oozy parts. If you can bandage that at times, those areas are very susceptible to infection. So that's the only type of scratch that I'm not a fan of allowing children or even myself to scratch is when it gets to the oozy point. I did speak about in my last video using a vinegar spray. You can go check that out, but that will be very helpful on areas like that. The red and inflamed stage, that is the itch that burns. And often when your child does that and then says, it hurts, that's because they're in the red and inflamed stage. Okay. So when they're in the red and inflamed stage, I don't really recommend scratch at that point either. However, there's not much you're going to be able to do once again. Once they finish scratching, have an ice pack ready for them, cold baths, hydrotherapy. This is all going to be effective at bringing down the inflammation. So if you see redness on the skin and your child is scratching, just know they are in a red and inflamed stage. And if they continue to scratch, their skin will burn and that will carry on for a while. Okay, there is a wonderful product called Uramol. I highly recommend that for if you just notice that your child will not stop scratching. It's great. It has urea in it, and what urea does is at 20% or higher, so you're going to have to make sure you get the 20% Uramol, it actually reduces itching in the skin. The last thing I want to tell you guys today is that your child is tougher than you think. I have survived eczema for almost 40 years. And as a child, yes, I was uncomfortable, but I made it through. Okay. Nobody's going to die from itching, from scratching, from being uncomfortable. So please know it's not the end of the world. Of course, you want to do everything you can to help your child, but there are elements that they sometimes it's just like they're just going to have to tough it out, and they can, find the things that make them comfortable, uh, which I'm sure you're already doing, and watching videos like this, finding good resources. But just know that they're tougher than you think, and they're going to get through. So, thank you for watching today, and I really hope that this was valuable to you. Know that you are your child's greatest medication. And as long as you are in a good mental state, you can do so much more for them than just a cream. So please don't forget to take care of you, mom, because I know I am a mom. It's very easy to neglect ourselves and then we become short and we don't want to rise our child's cortisol levels. So take care of you. Know that you are seen, and I really do hope to see you on another video. I like to post twice a week, lots of tips and tricks and products and product reviews and just different things that will help your child during their journey with eczema. Thanks.